Hi, my name is Dr. Ong. I'm a third-year internal medicine resident at HCA Florida Blake Hospital. Our case report is titled Tolosa-Hunt Syndrome and Periorbital Cellulitis After Cataract Surgery. Hope you enjoy. So, orbital pseudotumor is a rare eye condition that's characteristic of painful ophthalmoplegia. The pathology is a result of idiopathic granulomatous inflammation that can involve extraocular muscles, the sclera, uvea, lacrimal gland, or retrobulbar soft tissues. Tolosa-Hunt syndrome is a specific variant of orbital pseudotumor that involves a cavernous sinus and subsequently the cranial nerves. The syndrome has an estimated incidence rate of 1 case per million a year. The cause of orbital pseudotumor is poorly understood, but likely represents an autoimmune response or inflammatory process. This case report covers a presentation of Tolosa-Hunt syndrome simultaneously with periorbital cellulitis after a recent cataract surgery. The goal is to discuss the presentation of Tolosa-Hunt syndrome and also to discuss the treatment and recovery course associated with the disease after treatment. Our patient is a 62-year-old female with past medical history of congestive heart failure secondary to amyloidosis and type 2 diabetes, who was transferred to our facility with right eye pain, swelling, and visual loss. 2 weeks prior to admission, she had cataract surgery in the right eye. 1 week after, she developed blindness on the right eye with significant swelling and painful eye movements. She noted continuous right eye pain, decreased vision, and right-sided headaches. An MRI done showed lobulated enhancing soft tissue in the right apex and cavernous sinus mass with dural thickening and enhancement. Initial physical exam was significant for right-sided periorbital edema with ophthalmoplegia, afferent pupillary defect, complete visual loss, and ptosis. The left eye had diminished vision as well. She was started on vancomycin and ceftriaxone due to the suspicion of acute endophthalmitis post-cataract surgery and the possibility for orbital infection. Ophthalmology was consulted and confirmed that the patient had normal intraocular pressure with no signs of endophthalmitis or orbital infection. Further examination was significant for a frozen globe in the right eye with minimal orbital edema and also zero visual acuity and no detection of light in the right eye. While inpatient, the patient was treated with high dose of prednisone for 3 days, and as an outpatient, she would be tapered down for 2 months. The patient was started on vancomycin and ceftazidime because of the concern of orbital cellulitis or endophthalmitis. And once those were rolled out, she was de-escalated to doxycycline 100 BID and cefuroxime 500 BID for 10 days. Antibiotics and steroid treatment resulted in a rapid decrease in erythema and swelling noted on her initial physical exam. Her autoimmune screening panel was negative. Our patient was educated and informed that she will need to undergo further MRI scans as relapses are common. She was discharged on day 4 of admission. On discharge, she remained with zero visual acuity in the right eye and a frozen globe. Normally, neurological defects are thought to self-resolve in about 8 weeks, although in some cases, visual acuity may be lost permanently. MRI with gadolinium-enhanced contrast is a diagnostic imaging modality of choice, although these findings are nonspecific and can also be seen in other pathologies such as lymphoma, sarcoidosis, and inflammation. For this reason, the history and physical are quite important. In conclusion, Tolosa-Hunt syndrome is a specific anatomical variant of orbital pseudotumor that classically leads to unilateral headaches, unilateral cranial nerve involvement, and responds quickly to steroid treatment. Neurological defects should self-resolve within months, although in some cases, loss of visual acuity may be permanent. Orbital pseudotumor is a diagnosis of exclusion with differential diagnoses to include orbital cellulitis, apical orbital tumor, or lymphoma. MRI is a diagnostic modality of choice. And after initial treatment, it is important for serial imaging as relapses of this condition are quite common. Thank you for listening.